Hey Corner Crew, it is Christina and Cindy with Adaptive Equipment and Caregiving Corner, where we make videos and educate people on how to stay safe at home. We show caregivers, we provide tips and tricks to caregivers to show them how to care for their loved one, not only take care of them safely, but take care of themselves safely. And Cindy is a physical therapist. I am a speech therapist. And we have, we're on all kinds of social media. We are on YouTube, and we would love for you to go over there. If you like what you're seeing, if you find our content helpful, go to our YouTube channel, Adaptive Equipment Corner, and like, subscribe, and share. If you know anybody that might use this information or they might find it helpful, send it to them, share it with them.
Subscribe, it's free.
That's right, it is free, and you can be a member of the Corner Crew.
That's right.
Awesome. So today we're going to be talking about 5 tips to prepare for knee surgery.
Yes.
That's a big one. So we know a few people now that have had knee surgery,
oh,
right?
Yeah,
your dad's had knee surgery.
Lots.
Yeah.
Besides the clients that we've had.
Besides
over
the clients,
years.
that's exactly right. And so we feel like this can be really helpful for people to have these tips before you go have your knee surgery to get ready for it, right? So kind of prepare, right?
Yes, prepare.
Absolutely, so that you are ready for it. So let's go ahead and get started on it. We have the 5 tips for prepare. I'm having a hard time wording today, Sin.
Wording is not difficult.
Wording is hard today. Wording is fundamental.
That's right.
Okay, so we're doing 5 tips to prepare for knee replacement surgery.
Yes.
And tip number 1 is get your home ready, which is huge.
Absolutely.
Yeah. So tell us about getting your home ready. Some things like what, Sin?
Right. So you're going to most likely come home on some type of adaptive equipment, probably a walker.
Yep.
So you want to widen the pathways. Make sure your pathways to your bedroom, your comfy chair, to the bathroom, they are all wide enough for a walker.
Yep.
Worst case scenario, a wheelchair.
Yep.
We want to clear cords. We want to clear clutter. We want to make sure that the pathways are very well lit, especially to the bathroom at night.
Okay.
So that's just, preparing to make sure that you're going to be able to get around that house as easily as possible, because it's not going to be easy, because you'll just have surgery, but you want to make it as easy as possible and as safe as possible.
And so one thing I'd like to add would be to make sure that things that you might use frequently, now that you know your mobility is going to be impaired for a little bit, make sure you get those things that you use a lot out.
Yes.
And where you could easily access them.
Yes, so get them up at hip height or a little bit above. You don't want to have to be bending over for things.
Right.
Unless, if it's something you absolutely have to, you need to get yourself a reacher.
Yeah.
But you don't want to, you want everything about, chest or
countertop
hip,
height.
Countertop height.
Yeah, so put it out on the countertop in the bathroom. Put your stuff, towels and whatever. Put them on, put them on the countertop.
Right.
In the kitchen, put things that you might have to reach, down or up to get.
Right.
Put it out on the countertop.
Right.
So, number 2. So we're going to move on to number 2. But before we do that, Sin, I want to remind anybody that might be joining us that missed tip number 1, and now we're on tip number 2, that we are Adaptive Equipment and Caregiving Corner. Cindy's a physical therapist. I'm a speech therapist. We make videos and content to show people how to stay safe at home, and also for caregivers how to provide safe care.
That's right.
And we are going through the 5 tips to prepare yourself for knee replacement surgery. And we're on tip number 2, which is strengthen your pre-surgery health, or what we call
prehab.
Prehab.
Yes.
Right? So everybody hears rehab.
Right.
But we're talking
prehab.
Prehab.
That's
so
right.
what does that mean, Sin? Tell us
we
what
want to, I always encourage people to talk to their doctor and see if you can at least get a prescription to go to a physical therapist for an evaluation, even if it's just for one visit, to get home exercises to do prior to your surgery.
Yeah.
Because the better motion you have in your knee and the stronger your leg is, the better you will come out.
Right.
Now, you have to do it within reason, depending on your pain level, and the therapist can talk to you all about that.
Right.
But it's good to be as strong as you can going into that.
Yeah.
Now, the doctor, of course, usually the surgeon is going to say, if you're a smoker, they're going to want you to stop smoking because smoking is going to inhibit your healing, because of oxygen. You need good oxygen to heal.
It really is. That makes a huge difference.
Oh, it does.
I don't think people realize, that the smoking, what the actual smoking, the chemicals from smoking does for skin integrity.
Right.
Yeah,
right.
It doesn't allow their skin to heal as well as if they weren't smoking.
Right.
Or weren't a smoker. Yeah. Losing weight. That's a big thing.
Yeah.
We
Some
hear that
doctors,
quite a bit.
Yep. Depending on that, they may want you to do that too.
Mm-hmm.
So all that combination of things, just preparing for that surgery, is going to really benefit you as far as the outcome.
Excellent. Yeah. Okay. So we're moving on. It's Adaptive Equipment and Caregiving Corner. I'm Christina. This is
And
Cindy.
I'm Cindy. Yes.
We are the co-founders of Adaptive Equipment and Caregiving Corner. We have a YouTube channel, and we would love it if you would, right now, go to our YouTube channel, click the subscribe button. It's free.
Yep.
And you become a member of the Corner Crew.
Yep.
How awesome is that?
And you get alerts whenever we put out new information.
Yes.
And if you like the content that we're providing, please go do that. And while you're there, hit the like button too.
It's right. And share it if you know somebody.
That's right.
Maybe this doesn't apply to you, but maybe you know somebody. So, share it with your friends that maybe it might apply to.
Mm-hmm.
So what we're talking about today is the 5 tips for preparing for knee replacement surgery. And we're on tip number 3.
Mm-hmm.
Tip number 3 is to line up your recovery team.
That's right.
Yeah. Did you know you have a whole team?
Yes.
That's awesome.
Yes.
How supportive that sounds.
Right.
Yeah. So tell us a little bit about who might be on our team, Sin.
Yep. So you're going to, of course, want to get all kinds of information from your therapist and the doctor. If you have any post-surgical things that you need, to follow. You need to, they're going to tell you what your weight-bearing status is. They're going to tell you what assistive device, like a walker, you're going to be on. So doctor, you need to line up any family members, maybe home health. A lot of times home health will come out after a surgery like that.
Yeah.
And then, some of that goes to the social worker at work. Yeah. The other thing is that, you want to line up a family member or a friend to maybe get your mail, to make sure that you get meals, anything like that. And then when you're talking about lining up stuff, I have had in my past, there's been on occasion, a few of my clients that have come home and don't really have a lot of people to help their support system.
Yep.
But they have talked to their postal worker, and the postal worker will make sure that mail comes up to the door.
It's such a great idea.
Yeah, it's great. And then they also prepare in advance by getting those things that they might need for like a 2-week period, because usually it's about 2 weeks before you go back for your post-op visit with your surgeon.
Yeah.
So we're talking, toilet paper and groceries, and maybe prepare some frozen meals ahead and things like that you can put in the microwave. If you've got pets, think about, what are you going to do as far as feeding them and watering them? Maybe there is, I know that there's these things out there, that there's bowls that have extended handles on them.
Yeah.
Or if you're
the pet bowls,
yes. Or if you have a cat and you need to scoop the kitty box, litter box, there's long-handled scoops. So all of those things, especially if you don't have a big support system at home, or friends or family that are close by, those are things you need to think about preparing ahead of time.
Something too that I thought about was transportation.
Yes.
Don't wait till the last minute before your surgery to get that lined up.
Right.
When you might have a neighbor or a family member or a friend that could take you to your surgery.
Yeah.
I mean, it sounds
bring you
obvious,
back.
but I think some people get so wrapped up in the whole, it's surgery.
Right.
That you maybe forget to.
And then to take you
get there and get back.
Right. And to line somebody up to take you to your post-operative surgery or follow-up.
Yeah, your follow-up visit. Yeah. Absolutely.
Because that's very important. The doctor needs to see you.
Yeah, absolutely. So, all right. So it is Christina and Cindy. We are Christina and Cindy.
Yes.
Not it. We are.
Yes.
And we are Adaptive Equipment and Caregiving Corner. And we have a YouTube channel that we would love for you to follow.
Yes.
You can subscribe to us. That's right.
Corner Crew.
Be a part of the Corner Crew. Cindy and I are the co-founders of Adaptive Equipment and Caregiving Corner. We make videos, we make content. to show people how to age safely in place,
Yep.
and to show caregivers how to provide safe care, not only to keep their loved ones safe during the daily care, but also keep themselves safe while they are providing the care,
Yeah.
and kind of help, extend your caregiving journey, because caregiving is hard on a body.
It certainly is.
Yeah.
It certainly
So
is.
we are going through the 5 tips to prepare for total knee replacement surgery. We are on tip number 4. Tip number 4 is gather necessary medical equipment.
Yes. So
yeah, there's a lot.
There is a lot in that
but maybe
basket.
some of the more common things.
Yeah, well, I'll tell you, a lot of times you'll go to a pre-op kind of meeting, and you will have a therapist talk to you about what types of equipment, but that gets kind of, everything is kind of, everybody's excited and, worried and everything. So sometimes it kind of passes over and you don't remember what they said. But the big things, you're most likely going to need a walker if you don't have one. Most doctors will want you on a walker initially.
Yeah.
We always like to say, you need to check your toilet height, because I'm going to tell you, even if you have a comfort level toilet height, you need to check for, do you have a good place to push off from? Because when you have one leg that has had knee replacement surgery, you're basically pushing yourself up, pushing your weight up on your good leg.
Yeah.
On one leg.
Yeah.
And if you don't have good handholds to help you, most people can't do that very easily. And then you put a little bit of pain on top of that, and it's not going to be an easy job.
Yeah.
Now, for those people who have a standard size toilet, which are, the ones that are very short, you need to consider some type of a toilet riser with handles as well.
Okay.
You got to get up because that knee it's going to take a little bit to bend it, and it's not going to be something that you can use right away.
Yeah.
To help lift yourself up off the toilet.
Yeah.
You also want to consider, your comfy chair.
Yeah.
Where are you going to sit? Because I'm going to tell you, if your seat's too low, again, just like the toilet, it's going to be very difficult to get out of.
Yeah.
So, where have you been sitting? How low is it? Are you going to be able to get up? If not, you may need to look into furniture risers. You may need to, prepare for a different place to sit for a little bit.
Yeah.
But you got to get that level up, and it really needs to be up in the 17 to 19 inch range as far as the seat height.
Yeah.
It could even be, depending on your height, even taller than that, just to get up comfortably.
What would you say with that range, that 17 to 19 inches? Would that go for toilet height as well?
Yeah, that's
Okay.
most of the comfort height toilets are in that range.
Okay.
But again, if you're a tall person, that still may not be tall enough.
Right. Okay.
You may want to consider, if you don't have a toilet riser, you may want to consider a bedside commode frame over your toilet.
At least for the initial period,
Yeah.
the recovery period.
Yep.
Yeah.
Yep. And of course, the bedside commode then could be used by the bedside at night if you can't get up and get to the bathroom very easily.
Yeah, and bed height can be an issue too.
Yes, it can also be an issue. So you need to make sure that you're going to be able to get into that bed comfortably.
Yeah.
It's going to be a little tough with the knee surgery. A lot of times we'll suggest a leg lifter to help get that leg in and out of the bed.
Okay.
Absolutely. So we're talking bed height, comfy chair height, toilet height, big things.
Addressing those are the top 3 areas that we recommend.
Yep.
For a successful transition back home.
Right.
Because you don't want to get stuck in your comfy chair and you can't get out.
Right.
Yeah. Or get stuck on the toilet. Oh my goodness.
Yeah. And you'll be talking to the therapist, and they will have you do, if you have stairs into your home, they're gonna go over that with you at the hospital to make sure that you're going to be able to get up and down those steps.
Yeah, and don't be afraid to ask questions.
Yeah.
Ask your surgeon. Ask physical therapy, occupational therapy after the surgery. Ask them about that. It's they are a wealth of information.
Right.
They do this all the time, and they will have some really good recommendations for you.
Right.
Okay. Right. All right. Well, we are on number 5. Cindy, can you believe it? We've been through number 5.
All right.
Yeah.
Awesome.
Yeah. So Cindy and I are Adaptive Equipment and Caregiving Corner. We have a YouTube channel. We're on all kinds of social media.
Yep.
So wherever you like to see social media, Facebook, Instagram, LinkedIn,
TikTok.
We're on TikTok.
We
Two
are
old
on
ladies
TikTok.
on TikTok. YouTube. That's where we started, was on
Mhm.
YouTube. If you find our content helpful, if you find it interesting, we would love if you would help us out by going to our YouTube channel and clicking subscribe.
Mhm.
Be a part of the Corner Crew. Click the bell. That way you'll get notified every time we release a video. If it's something that you don't think that you would need for yourself, maybe there's somebody in your life that might use it.
Right.
We would love for you to show your appreciation for what we do by just clicking the subscribe button on YouTube. It's free.
Yep.
Cindy is a physical therapist. I'm a speech therapist. Together we have over 50 years of experience for therapy, for rehabilitation. And we just want to share it with people, and that's
right.
kind of how we got here. So today we're talking about the 5 tips that we think are important to get prepared for knee replacement surgery. We are on tip number 5, which is educate yourself about physical therapy.
Right.
Occupational therapy too, but
yes,
more importantly, I think, at this point, physical therapy. What does that mean, Cindy?
Well, you're going to have physical therapy. You may have some occupational therapy. Just depends on
for activities of daily living.
Right. How you're doing once you come home. You may be seen by an occupational therapist a couple of times. They may recommend some things, for getting back to when the doctor releases you to get into the shower, getting back in the shower. Maybe a shower chair to sit down. Maybe a tub transfer bench if you have a tub shower combination. Physical therapy, you're going to have, and I can't express enough how important it is to do your therapy. All the tissues that are cut through in a surgery to replace that knee are going to start healing. They're going to start laying down new tissue. And when that does, it kind of lays down haphazardly. And in your stretching and in your work on your range of motion, you are telling those tissues how long they're going to be and in what direction they're going to lay. And it is so very vitally important to work on that motion with your therapist, and do those home exercise programs, because I tell my clients all the time, you didn't go through this surgery for nothing.
Yeah.
You want to come out with the best knee that you can, and you will. But you just gotta really watch swelling, and you gotta elevate, and you gotta ice, and especially those first 2 weeks, it's kind of going to be boring. You got just the exercises. You've got to get up and move around a little bit. You got to get down and elevate it and ice it. It's going to be kind of that grind those first 2 weeks. And then the other thing, Christina, that I tell people as far as the therapy, and I like to remind people of this, especially with knee replacement surgeries, this is a major surgery. And if you had a major surgery of any other sort, you would be expected that your minimal recovery is probably going to be about 6 weeks. But because you can start walking on your leg after a total knee, people tend to think, well, I should be doing better than I am. And so it's
eye-opening, I think.
It is very eye-opening, So it's kind of a fine balance of making sure you're doing the exercises and you're moving, but making sure you're not doing too much. But I tell people, it's not going to be until that week about 5 or 6 that you start thinking, oh, okay, now I'm happy I did this, and that you're really kind of getting over the hump. And the whole time, and this is just from my experience with clients over the years, is that you kind of have this back and forth thing going on. You progress a little bit, you come back just a little bit, you progress a little bit more, you come back, but you are going to get better. It's just you got to stay with it and keep moving forward and keep doing what your therapist tells you to do. So 5 or 6 weeks. I think that might be eye-opening. To a lot of people. Absolutely.
Because you think maybe a couple of weeks and I'm going to be back doing what, not back doing what you're doing, but certainly I'm going to be closer to being back to doing what I was doing. And I think that's kind of, for me, that's right. I mean, that's a month and a half. And the interesting thing too, with a total knee especially, is there's a lot of strength loss in the quad muscles, and it just, even after 6 weeks, when you're back to kind of functioning more normally, it takes a long time to regain that strength. And you have to continue to work and be diligent about doing that. But it's a very
It can be a very successful surgery, and I've seen people, and we've both seen people
Yeah.
that have just been so happy
Oh yeah.
because they were so limited before.
Yeah.
But now they've got the new joint, and
Yeah.
they're getting back to functioning, and they're enjoying some of the stuff and the life as they wanted it to be before, but they
Right.
were limited because of the pain.
Yeah.
So
That's hopeful, Sin. I
Yeah.
appreciate you telling us about that and sharing your experience with us.
Yeah.
So that's all we had. We just went through 5 tips on preparing for knee replacement surgery.
Yep.
If you subscribe, go to our YouTube channel and subscribe if you find our videos helpful. And that way, whenever we release these videos, Cindy and I do Rolling with Ruby. We're on the road twice a week.
Yep.
And so we just try to kill time by talking about subjects we think people might find helpful. So if you find them helpful, please go to our YouTube channel and hit that subscribe button.
Yep.
Click the bell. That way, whenever we do release these videos, you'll be notified that we've got new content out there. Wherever you get your social media from, I guarantee.
Look us up.
Look us up. We'll be there.
That's right.
So until next time, it is Adaptive Equipment and Caregiving Corner saying so long to the corner crew.